that I can see better without or with. Well, you'll not be surprised to know that I'm going to argue fairly emphatically that there is a real overdiagnosis of mental health problems and conditions. I'm going to talk particularly about children and young people, but obviously you could make the same argument for adults now who seem to be coming forward in droves with ADHD and various other things. Quite interesting, if you look back to somewhere like 2007, there was a study done in which they found quite a high number, about 10% of children and young people in the age group 5 to 16 years were clinically diagnosed with a mental disorder of some kind. Bringing it up today, though, in 2023, the National Centre for Social Research, which provides England's official statistics on trends in something like mental health, that figure of 10% has actually doubled, so that it's now estimated that about 20%, that's 1 in 5 children and young people, are likely to have a mental disorder, appear to have. And of that very high number, it's twice as high for young women as for young men. And then if you look at something like eating disorders, there's now about 12.5% of children and young people have this diagnosis, and now about 4 times as many young women as men, although it's not an insignificant number of men have eating disorders, about 5.1% of the male population. And then if you look at estimates of things like ADHD, again, this figure of 5%, which is very, very high for a population, of young people and children. Estimated. Of course, if you look in the States, it's 11% have a diagnosis of ADHD. What I'm saying is I think we have to look much further back for the cause of this. And I would situate it in the early 2000s, probably about 2002, when education in the UK really fundamentally changed from one which emphasized an education based around subject teaching and became much more therapeutically orientated. You got the introduction of a sort of therapeutic education around that time. And the argument really was that cycles of deprivation, in the working classes in particular, made the children of families very vulnerable to emotional and behavioral problems. In addition to which, there was this very, very strong argument culturally, which wasn't really challenged, that there was a lot of damage wrought by emotionally illiterate or dysfunctional families and parents. And I think the idea grew, which was largely, again, unchallenged in education, that really educators and certainly the government saw that education was a really key point at which they could actually start intervening to develop children's emotional literacy, emotional intelligence, and well-being. And that really the responsibility had to move from parents to schools. Gosh, haven't even finished the first section. Okay, I'll speed up. Anyway, obviously, you'll be well familiar, I expect anyone with children, that things like circle time and so forth were introduced in primary schools. But it was when, in fact, it was introduced into secondary schools that these programs, mindfulness programs, well-being programs and that, were rolled out to the whole school. All pupils were then engaged in these programs. And again, this served the purpose of introducing to young people and children very early on psychiatric terms, psychological terms, and increasingly the symptoms of these sort of conditions began to manifest themselves, not surprisingly, in many young people. And as the symptom pool, if you like, grew, so all these programs in schools increased curricula, increased programs introduced. And unsurprisingly, young people began to reinterpret ordinary, everyday distress, the problems of life, began to interpret all of these problems through the framework of mental health disorder. I'll have to leave it there.